Because if you say that they're weak, they're gonna think, oh my God, I'm weak. Versus if you say, I need you to do exercises to strengthen, then they're gonna focus on the exercises they need to do to strengthen. Hey clinicians, welcome back to another video. And on today's video, I'm gonna talk about how we can communicate with a patient who is highly neurotic. And I just wanna say a shout out to Fakan for this question. By the way, guys, my name's Phil. I'm an ex-physio turned sales and communication coach, and I help you, the clinician, sell and communicate better in the clinic. First off, what is neuroticism? Neuroticism is one of the personality factors that is measured in the Ocean model, which is openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism. And what it describes is the extent of which somebody experiences negative emotion. Now, it's important to know that negative emotion does not mean it's bad. It just means it's a series of emotions that don't necessarily feel good. However, it does not mean that on an objective or morality level, it is a bad emotion. For example, anxiety, fear, sadness don't feel good, so they're classified as negative emotions, but it doesn't mean they are by nature bad or evil emotions. If you're high in neuroticism, not only do you have more negative emotion, but you're also more prone to mood swings. So you might go happy in one day and then you're very easily sad the next, or you might fluctuate a lot between anxiety and fear. Now, I know it sounds kind of unfortunate if you're a neurotic person because you're always feeling negative emotion. It's important to remember that being neurotic is actually really important for your survival. For example, if you're not fearful about anything, you most likely would have died by now because you don't think that it's dangerous to cross the road without looking. If you're not anxious, you won't prepare yourself well enough to go out in winter, you won't put on enough clothes, and then you'd probably die. There was actually a famous experiment where animal researchers observed a group of chimpanzees who were mainly non-neurotic, but they still had a couple of neurotic chimpanzees. And what they found was the neurotic chimpanzees would keep the entire group from doing stupid shit. Like if you were swinging on a bad tree, maybe the neurotic chimp would stop all the other chimps from going to that tree. And then what these researchers did was they actually removed the chimps that were neurotic from the entire group. And when they went back to observe what the group had become, they had actually all died. What it showed was that the neurotic chimps were essential to the survival of the entire group. So don't think that if you're neurotic or you're dealing with a neurotic patient that it's a bad patient. They just have a personality that is great for survival. So in fact, if you're going on a survival quest, they might be the best person to bring with you. Now, I know I've just said that it's not necessarily a bad thing to be neurotic. However, it can be a detriment because we now live in a day and age where a lot of the factors that they would be fearful of aren't actually real concerns. Especially if you live in a country like myself in Australia, or you're in a Western society that really doesn't have that much danger, then your neuroticism can actually amplify things that aren't really a big deal at all. For us clinicians, a neurotic patient is more likely to hyperfixate on a certain condition or certain outcome, and that actually makes them more anxious, which leads to a poorer recovery. You've all had a patient where you tell them your knee might get worse, and all they can think of is whether the knee will get worse, and they won't think about what they can do to get better. For example, you might have a patient who has back pain, and most back pain will resolve itself within 6 to 12 weeks. However, if they hyperfixate on the pain, then they might actually stress themselves out every single time they have a flare-up, and recovery might actually take 6 months or more. And worse yet, some guys are so neurotic that they never come out of the initial phase of pain. An extension of this problem is, in the age of the internet, you can basically find a cancer diagnosis for everything. So these people are at home reading and watching things that actually make them consistently worse. I have 3 main strategies when I speak to a neurotic person. The first strategy, which is the most important, is to focus on action-based process language. And what this means that everything I say has a strong bias towards doing something and taking control. For example, instead of saying to somebody, your back is currently weak, I'll say something like, your back needs to be challenged with more strengthening exercises. Now, can you see that I'm essentially saying the same thing, but I'm not saying that they're weak to their face. I'm just saying that there's things that you need to work on in order to strengthen your muscles. Because if you say that they're weak, they're gonna think, oh my God, I'm weak. Versus if you say, I need you to do exercises to strengthen, then they're gonna focus on the exercises they need to do to strengthen. Another example I might give somebody is, instead of saying, just have a rest or don't do anything, I might say, give me gentle movement and use a heat pack when you're lying down. Now, essentially, I'm saying the exact same thing, which is just rest from doing anything that is going to aggravate you. However, I've given them 2 activities to focus on because it gives them a sense of control and it's something that they feel like they're doing. Actionable tasks and language are great for neurotic patients because it makes them feel like they're not just sitting by and doing nothing. There's actually something that they're doing to make themselves feel better. A lot of these patients, they actually spiral out of control when you tell them just to do nothing because they're just thinking and they're so wired towards wanting to make it better that they can't help but want to do something. Strategy 2 is you actually need to learn how to withhold information. And the information you withhold are things that are beyond their control or might sound catastrophic. So you want to really avoid telling them the worst consequences unless they really request it. For example, if you know that poorly managed back pain can lead to chronic outcomes, you probably won't say that in the consult. Instead, you go back to actionable tasks. At the same time, if you're sending your patient to get a scan for something, you probably do well not to say, we're just gonna check how bad it is because they're gonna focus on, oh my God, it's so bad. Instead, you might just say, I wanna see the progress of our rehab. Essentially, you're looking for the same thing, right? But it's just different the way you present it. Although your intentions are exactly the same, changing what you withhold will prevent their spiral, and preventing their spiral is actually what's going to help them get better faster. And before we get to the last strategy, if you're enjoying this video, please subscribe and set your notifications to on so you can see the next video when it comes out. And the last strategy you'll need is to just improve your vocabulary. There are words that carry more weight and more harmful connotations than words that don't, and these all invoke a different feeling. For example, I can say water or I can say liquid. Now, if I say water, you think of something to drink, you might even think of a stream, you might even feel the coolness of a stream. But if I say liquid, you might think of something a little bit more sciencey, like a test tube or a canister. At the same time, I can say I go for a run, or I can go for a jog. The run seems more intense, but a jog seems more casual. But a run and a jog can be the exact same thing. In our field, we have to be especially conscious of the words we use to describe the conditions that our patients have. For example, instead of saying you have a muscle tear, you might say you have a muscle strain. Now, by definition, they're exactly the same. A strain you might grade 1, 2, 3, and a tear you might grade 1, 2, 3, but the tear sounds actually much worse than if you said strain. At the same time, instead of saying you have a disc bulge, I might say you have a sensitive disc. They're very different in terms of how it makes you feel, but they're similar in what they're describing. These small changes in words will completely change the way your patient interprets the information that you're giving them. And by changing how they interpret, you can control how they feel and respond to what you're saying. Remember that the aim of the game is to prevent your neurotic patients from spiraling out of control. So to recap, the 3 strategies that you can focus on are: number 1, focus on action, process-based information. Give them something to do instead of just giving them nothing. 2, learn to withhold information that is out of their control or could be interpreted as catastrophic. And 3, get good with your vocabulary. Because what you want to do is to word things so that they don't come across with the dramatic and catastrophic connotations that some other words do. Anyway, that's it for this video. I hope you enjoyed it and it helps you in the clinic. I'll see you on the next one. Bye.